Hi, and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In this video we're going to be looking at why other people are important for people who have dissociation. This might seem like a really obvious point that obviously other people are going to be important for anybody in some form or another, but this is one of those sort of key assessment questions that get used, and it actually becomes one of the therapy skills that can be utilized for people to help themselves within their therapeutic progress with dissociation and help therapists be able to work out ways of being able to understand what dissociation is taking place. And the reason for this is that within the assessment, obviously many people have dissociative amnesia. So one of the things that we hear quite a lot in our questions is that people say, I don't know what I don't know. So we might say to a person, what happens when you dissociate under conditions X, Y, and Z? And they might say, well, I have absolutely no idea because I can't remember anything. I mean, I'm only guessing that I've dissociated because I've lost time or things have happened. But I don't actually know, so I can't really contribute. There's nothing I can give you, and my internal world is a blank on this one, so I don't know what's happened. So that can leave us with what we would say is like a therapeutic impasse, is that we're both left sort of wondering exactly what may have taken place. Now, the other thing is that within the assessments for dissociation, we say, can anybody else offer some insight and understanding about what might be taking place with you? Because we also want to know whether or not people are commenting on the dissociation for the person, for this individual who dissociates, whatever their system looks like, however that's designed and set up, is that other people might be aware of it. And it's really interesting to know whether someone's observed enough for it to be commented on, because then it sort of moves away from the covert into the overt territory. And it might be that people are using names that the person doesn't necessarily have that can reflect internal parts. Or it could be that they're seeing behavior or emotions coming and going in a way that the person may not fully comprehend, understand, or even be aware of, but it is noticeable and observable to the outside world. And this is so important because dissociation is so often one of those conditions of hiddenness and shame and isolation that people try very hard to keep it away from everybody else for many, many personal reasons. So when it is observed in the outside world, that's a key thing for us as the therapist, whether we're doing assessment, diagnosis, or therapy, to understand and know exactly how this is being shown and portrayed in the outside world. Now, obviously, we're talking about people that would be trusted, because what we don't want is that people are sort of making up stories or trying to hurt or undermine that person's their sense of self or their progress through their own therapy. We're looking at people who can then contribute to the full understanding of what dissociation is happening and under what terms and conditions. As I said earlier, within dissociative amnesia, people don't know what's happening. So to gain an understanding of that is vital. It's a critical part of our understanding of what might be taking place within a dissociative episode or period. Therefore, if a person dissociates and they're acting, behaving, doing certain things under certain conditions, they might be triggered, they might be activated, they might be doing sort of fairly normal duties, but they can't remember anything about it, and maybe they lack the communication and the collaboration from the internal world for that, or they don't have parts at all. It could just be dissociation with derealization or depersonalization as amnesia. Then we have to try and gain some understanding of what might take place. And having trusted people being enlisted and being part of the therapeutic conversation, not necessarily within the therapeutic space, but available for comment and available for help, then that can be really useful. Now, within our clinic, we would actually, invite those trusted people within the therapy session if that was felt to be appropriate and relevant. We can say, well, how about this person come in? It could be a partner, or it could be a friend or a relative, or a professional can come in and offer us some of this insight and understanding of what might be taking place, because it really does fill out our understanding of what dissociation can look like, because it's very difficult if a person just simply doesn't know what they don't know. Then we can get stuck and we can just be guessing type things, but there can be a lot of distress and there can be a lot of fear about what might be taking place. And actually to gain reassurance from another person to say, here's what took place, and actually it was no big deal, it was fine, nothing particularly bad happened, everything was okay. That's a really important part of the sort of therapeutic reassurance that can be offered to somebody. Now, the caveat to this is that actually being told what a person might be doing when they're dissociative can be really distressing and can be extremely stressful. And sometimes people would rather not know. They might have examples where something's taken place and they're aware that something might have got said that they really regret or wish hadn't been said, or something got done that could be quite shameful or embarrassing. And actually be told that makes things very real. And for a lot of people, keeping the dissociation as far away as possible and pushed away can actually be sort of what they want, because of the phobic avoidance of being able to really get into it and work it and understand fully exactly what's going on. So sometimes wanting to know means that you do get to know, and then that whole be careful what you wish for thing takes place, that you might get told something which might be really embarrassing and distressing. So if that question is going to be asked, i.e., what is it that I'm doing when I'm dissociating, if that's asked to a trusted person who's honest in their feedback and they give the answer back to the person, be aware that that might actually not be very nice to hear, and that some resources and some support might be required in order to just be okay with that. Because when someone tells you that you have dissociated and maybe your voice changed or your manner changed, your behavior changed, these emotions changed, all of these things got said and done which seems really out of character, that can be quite alarming, because outside of it being like, say, a psychotic episode, which we're assuming it isn't, it can be a proof that the dissociation is there. And some people really don't want that. And other people, what we call is corroborate the information that the dissociation exists. There's no other explanation for it, and it acts almost as proof, as hard evidence that something has taken place without the individual's control that can't really be explained in any other way. Therefore, it's dissociation, therefore it needs to be dealt with. And that can be quite a big deal. What I'm saying then is that while it is really important for other people to be able to contribute to the process of therapy by filling in the gaps that dissociation necessarily causes, sometimes that can actually be really difficult to take on, for all the reasons stated. Is that firstly, it might be really embarrassing, and I guess secondly is that it makes it true that the dissociation is taking place. And a lot of people who dissociate rather just keep it all under wraps, pretend it's not happening, live in that sort of denial phase, and they don't ask those questions, because to ask those questions is to get the answer, and getting that answer means that it's real, and that can be terrifying for people, especially if they're newly diagnosed and they don't really understand what's going on. This is why it's so important to hold this or contain this within the therapy settings, so that that information comes in and it's organized and it's held between both the person who dissociates in their entire system and the therapist, and possibly the supportive other, so that it's done in a way that is safe, manageable, and actually takes some of that fear out of it, and it makes it something that we can do something with, which is a really positive step towards healing ultimately, and that's what we're trying to achieve. So therefore, we can see that other people are really important. It's built into our assessment process that we ask these sort of questions about what other people might see and experience when an individual dissociates, and to gain some understanding of either the symptoms or the system, whatever it might be, that builds up our understanding what the dissociation is taking place. It helps us guide that person towards healing, and it gives us information about the system as it's playing itself out, if that exists. So there we go. Really, really useful thing to do. Something that not everyone has access to, and it's quite a shame if people don't. But obviously, we try and work with exactly what resources are available to us. Please leave any comments about this video at the end in the section below. That's always really useful. We do love reading those. Like, share, subscribe, do all the usual stuff with the video. That's really wonderful that people are doing that. And we'll keep making the videos. And between now and the next video, please do take great care.